We are a part of the network of the social solidarity clinics in Athens. In the whole Athens district there are 14 of them, and in the whole country there are more than 40, up to 55 I think right now. The place is a donation. Everything you see here, the medicines, the drugs, the equipment, the furniture, the computers, everything you see comes from donations from people. Every service provided here is for free to the citizens. And what is provided here is we have several doctor specialties. Some of them they come here to the examination room and they examine the patient. Some other accept the patients to their offices, and of course for free. So what kind of specialties we have here? We have the internist, it's a general doctor. We have a cardiologist. We have an orthopedic, an ENT, otorhinolaryngologist, yeah, that one, the long one, the endocrinologist, what else? The pulmonologist for the pulm here, and we have surgeons, a general surgeon, a neurosurgeon, and a surgeon for the vessels, for vaso surgeon, for the veins. And we have a pediatrician, a midwife for the pregnant women, and we have doctors associated, as I told you, that they go to their offices and they go for free. It's the dentist, the ophthalmologist, and the dermatologist.
Okay,
so how people come here? For example, they come with appointments, they take a telephone, they call, they give a call, and we run on daily basis in the mornings and in the afternoons. So people call, they ask when the doctor is here, and they make an appointment and then they come. People who come here have lost their social security. 1 year ago, the government itself, the governmental organization for the primary health care, announced the number of the Greeks who lost their social security. And this number was at that time more than 3 million people. 1/3 of the population was without social security. Not only the people who lost their jobs because of the unemployment, because if you lose your job, then a couple of years later you lose also the social security, and the crisis is for 5 years. There are people without job for more than 2 years, and these people lose their social security. There are also the people who have small business owners, and these people are in even worse case than the unemployed ones, because the unemployed for a couple of years they have social security. The people who close their shops because a lot of shops were closed during the crisis, could not have any social security at all. From the very first moment they shut down their business, their small business.
You accept donations, only donations, I guess, no money.
Yes, because we pay no rent here, so no money is needed. And actually we accept very, very few money for the electricity bills, the water bill, etc.
Okay.
Kind of bill. And our expenses are really low, are less than 100 euro per month.
Okay.
And which kind of patient do you have here?
Is it
Almost any kind of patient.
Almost any kind?
Almost any kind. The doctors with the most visits are the psychiatrist and the general doctor. Their waiting list is, I mean, I can show you, it's almost full every time.
This is the oldest Solidarity clinic, the first, but it was before crisis. They start with people not from Greece.
And you have a popular population, or also middle class, and what do you see today?
Also middle class, because middle class lose job and also lose social security. They cannot afford to pay for this security, so they are also unsecured. Can be a doctor, a lawyer, an architect,
An engineer.
Yeah.
What would you say about the health system?
It's not so
Because
good
they cannot
situation
afford to
because
buy
it
the
was
medicine.
demand of Troïka
There is a
to
very-
reduce the
very
money to
nice
the hospitals
paradox with,
and also to reduce
their
hospitals.
prices.
Hospitals in Greek
price
were
has
130 and they wanted,
People's-
they planned
People's contribution to
to
the price.
have
increased.
only 70 hospitals.
We had those prescriptions from the pharmacies, and that's how we made the research. And we found out that the people's contribution, the patient's contribution, is more than 40% in all the cases we have.
Do you have a surgical block here?
No.
No.
Our surgeons, they might come here to see first.
Yes, for the
But
consultation.
if they need medical tests, then we work together with two individual
Okay.
centers. But it's not so easy because this is the law we put that they don't ask for money, so it's hard for them to pay from their pocket all the time. I mean, this is the main problem we have.
What about people with chronic disease like diabetes or?
We treat them here. We try to treat them here.
You can treat it because when we saw the social pharmacy on Friday, they told us that for them it was very difficult to follow them because it's a long-term conditions and it was hard because they didn't have enough drugs for them, etc., etc. Yeah, you can.
Sometimes we miss drugs, but we have this network of social solidarity clinics. We use internet and we recycle our needs concerning the drugs. We ask if there is something we miss, we ask it. We may not find it at the same day, but we can find it. And if not, then we make a public appeal on the internet, on Facebook, and then people come. Or when we have some drugs, some extra drugs that we don't need it, we put it on that group. It's a group, and then another social clinic can take it. Yeah, and we can ask for it.
Okay. What can we do to help you from France?
France has already helped. There is the Greco-Française Solidarité pour la santé, and they provided us with vaccines for infants, for babies. I mean, this winter we use their vaccines. They have already. France has already helped.
And how many vaccines did they send?
I don't remember the exact number, but I remember the value. It was something like €1,000.
Okay.
Little more or little less.
Okay.
I don't remember how many of each vaccine, but I remember the total sum.
And what would be the higher priority in terms of drugs or equipment? Vaccines? Is it the highest priority, or?
Yeah, vaccines and medical tests.
And for diabetes,
but
for example?
This is not a drug.
Which kind of medical test?
Diabetes also?
Yeah, for example. There are some projects depending on EU funding, but they are limited. I mean, there is a project that has 5,000 diabetes tests, but 5,000 for the whole country is zero.
For the whole country?
Yeah. There are a couple of such projects. We were asked to participate, but it's how many will we get? Like 1, 2, 3?
Yeah.
And actually, big companies are just beside on the backstage of these projects, and they want to promote that they help, but actually.
What are the relations with the pharmaceutical industry? Did they help actually, or did they just say they help and they don't, or did they?
I know
do
that
any
local Greek industry has also problems because of new laws. They also face problems.
Which kind of new laws?
All these new laws with the prices.
Oh.
As I told you, the price has decreased in general, but people's contribution has increased. And this affects to the Greek industry as well. They face problems. They help from time to time. But what we do here is, everything you see here comes from the people, not from the industries.
Yeah.
We did not have any donation from the big companies.
From international pharmaceutical companies, there are some help or nothing? No.
They may help, some of them, I know they help the church. Because church also is involved in primary health centers. They have, for example, the people who come here and work and serve in the secretariat during the mornings, they are unemployed.
The events of
if they work,
they start
they wouldn't be here.
I think a very bad day.
And are you surprised by this solidarity? Was it obvious that in such situation the Greeks would help each other and be so?
I'm not surprised. So, 4 years ago, in 2011, there was this big movement, people almost revolting, and socializing, protesting.
Maybe
From these people, from this movement, Solidarity movement cured. So I'm not surprised.
Because they are young people, someone sent them somewhere.
I'd say I would expect